Welcome to Generous Impact. This is Bret Brummitt.
And this is Amanda Brummitt. We are joined today by Dr. Cassandra Self, board member of Texas Native Health. Cass will share the incredible work of Texas Native Health in Dallas, from primary care and diabetes management to behavioral health counseling and unique services like human trafficking victim support and career training. Texas Native Health is building a comprehensive support system for the Indigenous community. Join us as we explore their impact, vision, and how they're creating a healthier future for those they serve. Well, Cass, thank you so much for being here with Bret and I today. I know that you and I first met volunteering with American College of Healthcare Executives, where I got to interact with you both on the DE&I side, as well as your leadership at Texas Health. But can you just kind of start at the beginning and share with our listeners who you are, both personally and professionally?
So personally, I'm a mom to 5. We have all the ages and stages. We have from 4 to almost 20. I recently finished my doctorate in healthcare administration last year. I've been in healthcare for about 20 years now. And in 2021, I actually earned my fellow from the American College of Healthcare Executives. So every year I try to set a goal for myself, whether it's personal or professional. And so that's kind of what I do and kind of push the kids to do as well.
Amazing. That is really impressive that you managed to do all that with 5 kiddos at home.
Yeah, it keeps it interesting.
Definitely. So, Cass, before we dive into Texas Native Health, language matters, and it's one of the few things in this world that we can control how and what we say. So can you share with us the appropriate verbiage around Indigenous populations, Native Americans, and what wording we should use when we're talking about the people Texas Native Health serves?
So it really prefers on the preference is by the person. And so a lot of times it's better just to ask, like, how would you like to me refer to you? Is it Native American? Is it American Indian? Is it Indigenous? Because everyone has their own feelings about it. So rather than offend them, just ask, like, what do you prefer?
Beautiful. I love that. Things would be so much easier if everybody was just comfortable saying, hey, I want to honor your wishes. How do you want me to word this?
Right. Yeah. Because you don't want to offend people, but at the same time, you want to honor their culture and what they stand for.
Definitely.
Well, Cass, I will, first off, listen to your history and your achievements. You mentioned you push yourself and you push them too. Is there anything that you've pushed them towards that's interesting?
So lately, 2 of our kids are high school seniors. And so that comes with its own challenge. So since they were in middle school, I've been challenging them to volunteer, get involved, give back to the community, do something for someone other than yourself, and it'll pay off in dividends. So whether that's student council or Key Club or working with HOSA, which is the healthcare organization for students. So what are you doing to help yourself be a better person, but also help others? And that's kind of how I live day to day. Like, what can I do to help other people? Because at the end of the day, it's me and my family. But if you continue to pay forward and give back, it just makes you a better person.
Well, I'm curious, with that much professional efforts for your career studying, like, what drew you over to the Texas Native Health Organization? And was that something that was just, I jumped into it quickly, or did it digest over time?
So I'm a Native American. I'm the citizen of the Muskogee Nation out of Okmulgee, Oklahoma, but I grew up in South Texas. South Texas, there's not a whole lot of tribal presence. There's no healthcare for natives. So if you want to go to an Indian Health Services clinic or hospital, you have to go to Oklahoma. From South Texas to Oklahoma is quite the journey. So for my dad, a few years ago, he needed to go in and have some stuff looked at his heart, but he didn't have insurance. So what do? We pack him up, we bring him up here, and we make the journey from here to Lawton 4 or 5 times in 8 weeks. Because that's how he...
That's a lot. Yeah, it's a lot. Well, and when you say South Texas, are we talking far south or like San Antonio south?
Corpus.
Okay, far south.
Yeah. It's a journey. It's a little pilgrimage back and forth. Mm-hmm. Yeah. So that's what really inspired me, because it's like, once I started digging in, it's like, well, what options are out there? Like, what can we do to help facilitate care closer to home, easier access to care outside of buying health insurance, which he was in the process of getting disability because of numerous injuries he'd have over the years. And so we were kind of in this like stuck, not sick enough for full disability, but like too broken to work consistently and be able to pay for insurance or earn insurance through an employer. So that's the only option we had, was to go back and forth to Lawton. And then that's when it kind of opened my eyes, like, this is a healthcare desert. There is no care available unless you're willing to get, bazillion dollars in debt. Because again, he was in that weird income where it made too much to qualify for aid, didn't really have any of the diagnoses to qualify for Medicaid, the assets. So there was a lot against being able to try to qualify for any of that, but he wasn't old enough for Medicare, wasn't on disability quite yet. And there's a 2-year waiting period to get Medicare once you're on disability. So he's in this weird purgatory. And thankfully, we did have the option of being able to get him here and then make the efforts to get back and forth to get him the care he needed. And at that point, that's why I started doing the research of like, okay, well, if there's not Indian Health Services clinics in Texas that are actual IHS signs on the door outside, what else is there? And that's when I had found Texas Native Health, but at the time it was called Urban Intertribal Center of Dallas.
Which is still a good trek from Corpus Christi, even at that route.
Right. It's like 450 miles from Corpus to Dallas.
Yeah. So finding them there, was that like they're here, or there is something, or did it take a lot longer journey before you started getting involved?
So that was about 5 years ago. And I started noticing, hey, they have healthcare, they have community programs, they have things for the kids. They're pretty involved, but it was kind of like it was hidden and you didn't really know about it unless you knew about it. The Dallas side has a lot more of a Native population. Fort Worth, not so much, but I think there's more awareness coming to the Tarrant side. But a few years ago, Urban Intertribal Center of Dallas decided to rebrand and rename, and let's really get engaged with community. And we don't want to pigeonhole ourselves to just Dallas. So let's rename Texas Native Health and be able to serve the Native American population of Texas. And how do we do that? And how do we reach people where they're at? And how do we do the things that they need us to do to help them access to care? So it started off just, basic healthcare, basic primary care, disease management. And over the past few years, the new CEO, Omer, has really taken control, has redesigned the whole clinic where it's like bright and shiny. It's super fancy. They have state-of-the-art equipment. They have a community center now, so people can come in for job training, help me write a resume, help me earn some skills to get employed. So it kind of helps break that cycle of, okay, if I can get skills, then I can get a job, be a useful member of society, and I can give back. And so helping kind of break that cycle of, I don't have access to care, I'm too sick to work, and you kind of get stuck in that rut. I think it's been a tremendous effort of all the things they've done to help build the programs they have there. And now they have podiatry and they have dentistry, and they're really building out the programs that are available. And they do annual needs assessments to find out what is it you need from us, or what's on your wish list? What can we do better to help you? Is it a certain medication you're on that we don't have? Is it you need a certain specialty that we currently don't have? So tell us what you want and what you need, and we'll see what we can do to get it.
Yeah. And then curious, like, what is the barrier for someone to receive care? Do you have to have a specific tribal card, or is there certain ways of proving the Native history?
So you do have to be a member of a state or federally recognized tribe. Tribes do issue an enrollment card once you prove up your citizenship. Sometimes it's through the Dawes Roll, the late 1800s and early 1900s, and some tribes want that. Some tribes do blood quantum, so they want to know, are you a quarter, are you a 16th? Every tribe's different on how they decide who will be citizens of their sovereign nation. So you kind of have to dig back into the waybacks to figure out where your lineage is. But once you're enrolled and you have your tribal citizenship, whether it's state or federal, you can go to Texas Native Health and receive care 100% free.
Amazing. And so how did you go from knowing about it through your dad to joining the board? I mean, I can imagine with your logistics and procurement and healthcare background, they were like, please, we want you. But how'd that happen?
So it's funny because before, I guess it was like 5 or 6 years ago, they had the CEO role open. So I was like, you know what? I'm going to apply. See what happens. Nothing happened because I'm still at Texas Health. But it was interesting just to even see, because it's like, even though I didn't get it, the person they did pick was the best person for the job. He has done so much to help the community as a whole, but also he's very strategic in how he thinks, and he's very consumer centric, which is what Native Americans need in this area, because it's, like I said, it's a desert between here and Oklahoma. There's one other tribal clinic I found that was in Houston by the Alabama Coushatta tribe. But between here and there, there's nothing.
Wow. So let's dive in a little bit, or not a little bit, a lot, to what Texas Native Health does. And for our non-healthcare people, I just want to let you guys know, and our healthcare people, because you're going to care a lot, that they are AAAHC accredited. They are a patient-centered medical home. And for those of you in healthcare, you know what a big deal that is. For those of you not in healthcare, this is tons of hoops that an organization has jumped through to meet all kinds of different criteria, and they have to meet it on a continuing basis. So, we're talking about really sophisticated healthcare. This is not just a small little nonprofit clinic. You guys have primary care, diabetes management, behavioral health counseling, dental care, human trafficking victim counseling, and then even the career training you were talking about. So, a lot of services. How do you bring those all together to really create that comprehensive support system for the community?
So there's a lot of community involvement. They do back to school fairs. They have community involvement with the AT&T Intertribal Council. They go by IK, but it's AT&T employees here within the DFW area, and they have their own events, and Texas Native Health gets involved with that. Or if there's going to be member outreach for different tribes as they come down into Texas to, meet the members or the tribal citizens where they're at, Texas Native Health will try to get involved with that. Hey, even if you can't get back to your reservation or wherever you need to go for care, you can come to us, or you can rent space from us if you want to hold your cultural events in our area. So they're trying to do a lot more to just take care of people and make sure people have what they need to be the best they can.
Yeah, it sounds like they're really trying to meet them where they are, regardless of if that need falls directly into health. You guys can't see it, but I'm making air quotes, or not. I really like that.
Yeah, because like I said earlier, it's a cycle of how do I get a better job? How do I make more money? How do I be able to afford the things I need on a daily basis?
Mm-hmm.
And so it all kind of compounds on each other. But at the very base of it is health. You have to be healthy enough to do these things. You have to have the skills. And so how do we do that when sometimes that's cost prohibitive? Well, this takes down that barrier totally. And it's just, if you can get here, if you can sign up for the classes, a lot of it they do online.
Mm-hmm.
So they're trying to, like you said, meet people where they're at and really provide them with what they need.
Yeah. And are the services all free? Is there any payment component?
There's no payment. It's all 100% free for anyone that's federally or state enrolled with the tribe.
That's really cool. Removing that barrier. I mean, you just mentioned the travel barrier. If you're having to add the payment on top of it, that just keeps someone away that probably really needs the assistance or the touch point.
Right.
So with that, and since let's just focus on the time since you became aware of them till joining on the board. What are some of the impacts you've seen, that make in the community?
So they're really strong on, kids and students. So what can we do to help make them successful at school? Kind of starts at the very beginning. It's pre-K and kindergarten and all the way up. So they provide a back to school fair. And so you sign up, you put what age or grade your kid's going into. It's a quick Google form. Come on this date and time, and you get a box of supplies with a backpack. And they have various tables around the room where you can find out what the public libraries have going on. You can find out what UT Arlington and TCU have going on for the Native American students. So they try to help foster the education very early, but then they also tell you, well, here's the different community events we have going on. Here's the different community assets we have. So if you don't come here, here's where else you can go. Here's the different programs that are available in your public school that you may not know about. So they have a lot of community advocacy at that event, but they're very good about sharing food pantry, food bank. Hey, come this date and time, we're going to have whatever food bank here, and it's a drive-through event. So they try to make it as easy as they can, as quick as they can, so don't take up a whole lot of your time, but they put the information out far enough ahead of time where you can plan for it, towards not like, hey, tomorrow between 11:30 and 11:48, we're going to have this. It's like, well, I can't plan for that. I don't know if I'll be there in time. So they're really good about communication. There's a monthly newsletter they send out via email. They post it on their Facebook site. They have a web page. There's various means of communication that they try to get out to everybody.
I love that it's not a siloed effort too, and they're intentional around the other services available on the broader community scope.
Right.
With that, I mean, how are you able to measure success on the efforts you're making as an organization?
So I think what they really look at is number of lives served. So are we getting more, not just people in the clinic, but how many people are coming in for their dental exams? How many people are coming in to get their feet checked because they're diabetic? And that's a huge comorbidity of having diabetes, is having problems with your feet. How many backpacks did we give out? How much food did we give out? So they try to do measurable things to figure out what impact are we really having on the community and doing things that make sense. So if an event is a flop, it's like, well, I don't know if we necessarily want to do that again. Let's ask that on the community needs survey if that's something that maybe we shouldn't time it right, or maybe people didn't know enough about it. So let's find out if that's something that's viable, or if we need to go back to the drawing board and find something else that might be better.
And have you had any of those that have been like recently updated or changed or morphed through that feedback
Not
loop?
that not that I know of. I know the most recent event they had was the Christmas event, where they had, gifts for kids, different supplies. So it turned out being bigger than they thought it would be. So they were very happy that people came out, because you never can tell with the holidays and availability and weather if people are going to show up or not. So it was a success.
So, as you're talking through all this, it sounds like Texas Native Health doesn't want the community they serve to just exist. They really want them to thrive. Like, they're really improving their lives. And I think historically, the Indigenous populations have shrunk in the US. Like, is this something where, if they're successful, that you could actually see the Indigenous population start to grow again here in our country?
I think, and this is my personal opinion, I think there was a stigma around being Native American. And so
Mm,
a lot of the history got lost. And so if your
mhm.
family didn't carry on, hey, making sure you get your babies enrolled with the nation, if you don't do that, then that kind of like, that's a line in the sand. And then
Yeah.
anyone down the line further from that would have to go back and prove up with death and birth certificates and show the lineage.
Right.
So I think personally, it's kind of coming back around of, hey, let's talk about the culture. Hey, let's talk about the things that have happened in the past and let's learn from them, but also be aware of these languages are dying, these cultures are dying. So, what are we doing to keep this stuff alive and relevant? And
Yeah.
so, a lot of tribes have put a lot of money and efforts into language revitalization and culture
Hmm.
revitalization. Because I know my tribe does, and I've sent my
Hmm.
son for multiple years, and it's amazing what he's able to learn. I mean, even like basket weaving and moccasin making and finger weaving with yarn. There's all kinds of stuff that if he didn't go there and learn those things, he wouldn't have gotten otherwise.
Yeah. And what a beautiful legacy to have. Definitely
Yeah,
something I would be very proud of.
right. Yes, we have little baskets everywhere now.
Nice. Okay. Shifting gears just a little bit. So, I know that you are really into operational efficiency and, running organizations well. So I'm curious, with your professional background, but also your personal connection to the work, how will that shape your philosophy on the board of Texas Native Health?
I think because each of the board members has their unique quality, we're all from different industries. And so that kind of comes together of, okay, I'm looking through the healthcare lens, and we have a physician and we have finance and we have, you know, people that are professors. So there's all kinds of different types of people coming together to making sure that we're kind of hitting all the angles and knowing in healthcare different metrics and how are we measuring that and what makes sense. So we all kind of have our lens on it, but making sure the overall picture is where we want it to be going.
Yeah, definitely.
Yeah. So thinking through that and back through all the different expansion you've already talked about, are there any like service lines that you really want to see expanded or grow in the next 5 years?
So with the rebranding of Urban Intertribal Center of Dallas changing to Texas Native Health, that was they want to broaden their scope. Don't want to just serve DFW. They want to serve throughout Texas. And so recently they've looked at hiring behavioral health counselors like LPCs for the San Antonio market, for Austin. So they're trying to have more of a reach because they know that's a need. And from that, it's like, okay, well, do we have additional clinics San Antonio or south or out west and out towards El Paso? It's where's the need that this would really have the biggest impact? Is it outside of mental health? Is it chronic disease management? Is it primary care? Like what almost would give the biggest bang for the buck? Or is it pharmacy and shipping stuff to people so that way they're not having to come back and forth to the clinic to get their refills? So really trying to think strategically on, of course, you have to keep the ship afloat. You have to meet budgets. You have to meet revenues, all that. But what would be best for all of the patients that are served? And so that's, strategy. Every few months we meet and try to figure that out and make sure we have a good strategic plan.
And then with that, different regions, of course, and services, is there one that kind of comes before the other? Is it like duplication or replication to other areas first, or is it expansion of something new?
Bret, it's Corpus Christi. We need a clinic down there to take care of her dad. Gosh.
The board member has to recuse her own needs.
My personal needs.
Yeah.
Right. I honestly don't know. I don't know what makes most sense right now with the economy and inflation and how much it costs to build places. And we don't really know how telehealth will be impacted, if we're going to be able to keep it or if it's something that'll have to go away. There's so many unknowns right now. It's hard to tell what would be feasible. Is it telehealth primary care? Is it telehealth behavioral health? Like, what is it that we're able to do within our scope and feasibly able to provide great care as well?
Yeah. And that's, I guess the question out for everyone, obviously for, not regular for-profits and the bill on that, it's a huge item. But for you guys, like staying within the scope and liabilities and not having issues, got to be a super concern about when that sunsets or doesn't. So glad you're thinking about it for sure.
Yeah.
All right. So this is super inspirational what you're doing. You've obviously come into this from a, consumer to the insider side. Through that journey, is there anything specific that inspires you internally from the organization?
I think because they want to kind of like myself, continually improve, continue to make things better, continue to give back to the community the best way they can. And very strategic, very conscious of the money aspect of it and making sure there's revenue streams, making sure there's grants being sent, grant proposals sent in, and just being conscious of what we're doing and how we're getting there. So if care is 100% free to the people coming in, how do we keep the lights on and how do we keep the staff paid? So there's an awareness of that, but also providing the best service we can, keeping people healthy, but also finding those alternative methods outside of just Indian Health Services to get money to do all those things. So like the current campus is on 4 acres. They've totally renovated it. They've added space for perhaps real estate rent out spaces to other providers. So they're trying to think through a lot of different things, but making sure that at the core, they have what they need to take care of their patients.
Yeah. All right. So are there other outside people that influence or organizations that inspire you that you draw from for strength or vision?
All the organizations I stay close to have, personal ties. So I'm not just doing it to check a box. It's like, yeah, it looks nice on paper, but if you're just halfway in and not really committed to a lot of things, and it's like, what are you doing? And so if I'm going to do something, I'm going to do it all the way. And what can I do to provide best effort and really help people and not just be like, I'm here to get my hours or I'm here to meet people to get me something. So you have to kind of take yourself out of it and really, what are you doing for everybody else and how are you going to help them get there?
Yeah, cool. All right. So what can we as a community do to help Texas Native Health?
So they are a 501c3 nonprofit organization. So we will be happy to take donations any time of year. Also just promoting what the clinic is, who we are, where we're at. If you know anybody that's Indigenous or Native American that needs care, send them. That's what they're there for. If you see requests for donations for canned food drives or backpacks or anything like that coming from the clinic, please support in whatever way you can. Because without the support and donations and grants, you can't really keep the doors open.
Yeah. Is there a spot someone should go to let you know that there's, people or services needed in an area like the survey?
So if you sign up for the newsletter from the website, you'll get that monthly information. But I know they send the survey out once a year via email and just ask, like, what's your zip code? What county are you in? So they try to really hone in on where the needs are. But they have patient navigators. They have people there at the clinic that are able to help. So at any given time, you can call the clinic or email them, and they're able to wayfind.
Well, so really, first step, if someone's online, just sign up for the newsletter, and that will become the first touch point of entry.
That, or go to their Facebook page and like them there as well.
Nice. Well, thank you so much for spending the time and, getting a little vulnerable about some of the stuff in your personal journey with your dad. Really appreciate all the good stuff you're doing and all the insight you've given us.
Awesome. Thank you for having me.
What an amazing resource for the Indigenous community in Texas. Texas Native Health is truly improving the lives of people in their community through better physical and mental health, and also through career services. They are literally just taking care of people. I hope that you are inspired by Cass and Texas Native Health, and if you want to learn more, check them out at texasnativehealth.org.